Good day. Today will be on MCQs based on the 5-part series on daycare surgery. As you know, we had split it into parts so that it's easier for you to understand and retain. Now the explanation will be done using the same appropriate slides. As I told you, the content is from Bailey and Love. There will be a pause after I post the multiple choice, STEM and the options so that you get some time to analyze and come to your conclusion before I choose the right answer. And all the very best. This request, please do watch 1 to 5 parts of the daycare presentation. Try and understand the core. MCQs now will become easier by sheer default because you got a grip on the core. Rote learning will not help you to clear NEET and next, which is a short-term goal. More so, rote learning is not going to stand by you in the long term when you're going to handle patients and encounter patients and medical problems day in and day out. And your analytical skills are better developed when you understand the principles and then attempt your MCQs. So as I told you, please, you must have read or watched all the 5 parts. Daycare surgery is also known by all of the following except, as I told you, there are minimum 7 ways of calling daycare surgery. So it can be daycares, whatever. So except, I'll give you some time. I've written the answer there by mistake. Except 24 hours surgery, it is actually a 23 hours surgery. Have a look. So alternate names are any of these, and in India it is known as daycare surgery. The main benefit of daycare surgery is it's very useful in children. Now mind the question, it is main benefit. So look at the question carefully before you jump. Very useful in children, short hospital stay, financial, morbidity is less. So I'm giving you a few seconds to come to your conclusion. Let's see the answer. It is financial. Sorry, it is financial. The main benefit is financial. Let's look at the explanation. Every healthcare system in the world is resource crunched. I have emphasized this. Now, because you use patients into your daycare, you can use up the beds for major and emergency work. Now, you know the expenditure per day on a hospital bed. This is a public hospital bed or a government hospital bed. So, you know minimum patient stays 3 days. But if you make it 1 day, then you even cut down less. And you know the large number of cases, minor cases that are being done in the government side. And you know the savings to the government by adopting daycare units. Now, the duration of surgery in daycare units by convention should not exceed 30 minutes, 45 minutes. It is 2 hours. Let's have a look. Up to 2 hours. That's why I've written should not exceed. More than 2 hours, then you wouldn't be scheduling them in the daycare. So as you know, these are the criteria. We are again trying to go and look back on that slide, and the duration of surgery is about 1 to 2 hours. This is timing criteria. You have a whole lot of other criteria to fit into your daycare process. Now, coming to discharge criteria for daycare includes all of the following except patient should be fully ambulant. Pain can be controlled with oral analgesics at home. He should be alert, tolerates fluids or feeds. I'll give you some time. look at the stem properly. When they are not able to get you options very close, then what they would do is they will write except, none of the above, true of all of the above, and things like that, so that they want to know your depth. Now you cannot get, not all questions will get options very close to each other, so the only way to avoid is to give except, none of the above, all of the above. So read the question carefully. Whenever the word except comes, all are true except, all are false except, be very careful. Give you some time. Except fully ambulant. Patients should be ambulant, but nobody insists they should be fully ambulant and run to the bus stand. Some reasonable ambulation should be there. With aid, he should be able to walk to the toilet, or if he is able to walk on his own is okay. But you cannot insist on fully ambulant. Rest of the criteria remain. Let's look at the slide, the relevant slide for this. See, reasonably ambulant. What if you have done some plating or a small thing on his metacarpal? What if you have done a corn foot? You don't expect him to be running around. He will be reasonably ambulant. Patient suitability can be considered during any of the stages except surgical OP, after your investigations, pre-anesthetic clinic, on the day of surgery, none of the above. Now, let's have a look. I'll give you some time. You can do some analytics. Let's have a look. None of the above. You don't find him suitable even after giving him a date for your daycare. He has come all the way. If you don't find him suitable, don't play with him. You can even cancel that time. That doesn't mean all your other processes can go bad. You need to be very cautious in your OP. Look at the investigations properly. Do the pre-anesthetic clinic. On the day of surgery, if still somebody, your senior, finds him unfit, yes, you need to cancel. There is no question saying we have given him date, we have to do this case at the expense of his safety. No way. So you can cancel, but that doesn't mean the rest of the stages you will be you will be careless and bring him to this stage and cancel him. You are accountable. Your audits will be able to pinpoint where exactly the process sagged. So as I told you, all daycare patients, you will take a proper history. You might ask for investigations. In the history, you might say is unsuitable for daycare, not unsuitable for surgery, unsuitable for this procedure in the daycare. You might order some investigations and review the investigations and find him unsuitable. Or you might review and find him suitable. No problem. You will call him to daycare, but you would have found him unsuitable. So you need not stick your neck into trouble, put the patient at risk and yourself at risk. So at any stage you find them unsuitable for reasons which are very, very valid, you will not be able to put him in the daycare. The following induction agents are used in daycare except I have clicked that answer by mistake. It is servoflurane. Now your fentanyl, propofol, ketamine, all of these are induction agents, but that is your IV induction agents, but your inhalational induction agents come with a fair risk of nausea and vomiting, which you do not want. So you will be using IV induction agents even though they are more costly. And when it comes to opioids, you will obviously choose the short-acting opioid. because you don't want the opioid to be still peaking in his blood when he is discharged into his home, because you can use regional and local anesthesia too. So the commonest cause for overnight stay after daycare is patient cannot go home as transport not available, anesthetic causes, surgical causes, pain relief not adequate. We'll give you some time. This is usually anesthetic causes. Let's look at the chart. Mostly it is dizziness, vomiting, and other operative issues. So it is, and surgical bleeding is less. And pain is the next one. But mostly it is vomiting, dizziness, etc. The commonest problem that leads to cancellation of a daycare surgery is failed logistics. You did not get the instruments. The staff didn't turn up to the hospital. Your anesthetist is sick. The anesthetist posted there is sick. Or the lights in the OT are not working. 101 logistics you can bring in. Inappropriate assessment. Patient does not turn up. Patient develops an incidental problem like URI on the day of surgery. Quite common in children. It can happen in children, not quite common. Or the patient says, I've got a headache today. Now these can all occur. But what is the commonest cause? It is inappropriate assessment. Don't put the blame on no light in the OT. They will arrange a light. Don't put the blame saying anesthetist didn't turn up. The department will arrange another anesthetist. Don't say patient did not turn up because bus didn't come. There are buns, I agree. But buns being the cause of your daycare going downhill, cannot accept. It doesn't happen. So the main thing is with us, it is inappropriate assessment. Everything else you can find an alternative except for inappropriate assessment. For failed logistics, always your administration will be able to give you alternatives. And patient not landing up is a very rare occurrence. Patient developing an incidental problem is also very rare. So why are patients cancelled on the day of surgery? It is assessment problems. Patient changing mind or surgical operation unsuitable or unnecessary. Probably a junior has seen him. One more senior steps in the hierarchy, steps into the picture and feels no, this surgery cannot be done. Those are all very low percentage. Daycare surgery is gaining momentum due to all of the following except insurance company payouts, minimally invasive surgery, better anesthetic techniques, word of mouth publicity. Except, look at the stem, it is except. Be very careful when this word except comes. There will be two negatives in the same stem. Let's see the answer. Insurance companies. Minimally invasive surgery has only come and given a flip to daycare surgery. Better anesthetic techniques, better induction agents have come with far less side effects. Word of mouth publicity is a big strength. One patient will go and tell his whole locality. I was able to go in the morning. They looked after me well. I had no problem. I recovered. I came back. I am home now today, enjoying myself. If he is in Pondi, he will enjoy himself to a peg. Or somewhere else, people will have their own way of enjoying. They are already at home. This is in a lighter vein. Not everybody in Pondi is looking for a peg. So now medical insurance covers a small fraction of the population, but most of these insurance companies still insist on a 24 hours admission. So these are the MCQs. Please do like, share and subscribe. There are about 10 MCQs, but I have picked up the core problems and made them as MCQs. Please go through these 5 parts. You will get a grip on the core. Number 2, please do not rattle the types of surgeries that can be done in the daycare. like hernia, hydrocele, breast lumps, hemorrhoids, anal fissures. It goes on and on. You know, the list is endless in urology, in orthopedics, in general surgery, in gynecology. It can go on forever. That is not the principle. The principle is to know the core issues in daycare surgery and how best, what are the benefits, what are the problems, how best we can find solutions, and how best we can scale up your daycare services. Thank you. Please do like, share, and subscribe. I do find many views, but it is not getting converted to like or to subscribe. Please do like, share, and subscribe. Thank you.